Okay, welcome back to our FaceTime Live at Intermountain Pet Hospital. I'm Dr. Hunt, and today we're going to talk about pet first aid. So I understand that a few days ago we learned about anal glands and anal gland expression, which is really exciting, and I hope that you learned a lot of important things there with dogs and their anal glands. But today, as things get nicer, I'm looking at my weather forecast. Looks like we're going to be in the 80s later this week. And what that means to me is that you are more interested in getting outside. And when we go outside with our pets, we love the outdoors, we love the time that we have with them, we have a great time, and sometimes things happen on accident and we need to intervene. So I thought that we could talk about pet first aid today. So we're going to go over the basics of pet first aid, what it means to do first aid, and when you can intervene and when we have to get involved on the veterinary side as well. But hopefully we can keep your dogs and cats safe and what other animals you have out there safe while we go out and enjoy the outdoors. So pet first aid. When we talk about first aid, I think one of the important things that we have to recognize as people is when something happens, we often get really worked up and excited and we get nervous and scared. And one of the things that dogs do in particular really, really well is they look at us and they see that. And when they see that I'm nervous, they get nervous. So the first thing that I always recommend with pet first aid is first, check your own heart rate, check your own respiratory rate, make sure that you are relaxed, calm down, and then you can focus on your dogs. And they will look at you and say, it must be okay because my master is okay. So first, check your heart rate. Our goal here, of course, is to provide care to a patient in the moment of emergency until medical services can be reached. That's our objective with pet first aid, or any first aid for that matter, is simply to buy some time until routine health care can be reached. So if you're up there in the hills and you need to get some care, then you can do the care that you need to keep things stable and then see your veterinarian for additional care. All right, so the other thing that I think is important is as we go out there and we are going to step into the arena of medicine in any kind of way, is I need to know what is normal. Like, well, how do I know my dog or my cat or my bird or whatever you're working with is healthy if I don't know what is normal for them? So we can look at their mucous membrane color. That's a really, really good clue into a patient's stability status. And you can look at your dogs when they're healthy and look at their mucous membrane color. As you can see on this little example, it should be kind of pink. But what you'll notice in a lot of dogs is that they have pigment on their gums and their tongue. That just means that they're black. Normal discoloration or color of their skin. And that's not abnormal. So you have to find a place that is truly pink before you can assess their mucous membrane color. So I invite you to do that now with your dogs and your cats. Look at their gums. Just lift the lip like this, and you'll see the normal color of their gums. You can also look at their capillary refill time just by pushing on that pink area with your thumb and then pulling away, and you'll see the color dissipate. It'll turn kind of white, and then it'll turn back to being pink. That's called your capillary refill time. Other things that you can do is you can check their heart rate. How do I know what a heart rate is on a dog? Usually it's pretty easy to know. You can look right behind the elbow here on a dog or a cat and just rest your hand right on their chest, just behind their elbow. And just give a second and you'll start to feel the thump of the heart. It'll thump against your hand. And you can count how many thumps you feel in 1 minute, and that'll give you your heart rate. A simple math equation there for you is count the thumps per 6 seconds and then multiply that by 10. So then you can do your assessment in 6 seconds and know how fast their heart rate is going. Breathing rate is the same. You're going to watch their chest expand and then decrease and expand and decrease, and that'll be your respiratory rate, your respiratory rate. Once again, count for 6 seconds, multiply that by 10. Dogs' temperatures and cats' temperatures, just so you know, they're a little bit hotter than most people. people were up 97, 98 degrees Fahrenheit, whereas a dog, we're naturally between 100 and 102.5. So when you're checking their temperature and you're concerned about the heat outside and heat exhaustion, we'll talk about that, their temperature is normally at 102 or 101, especially if you're out running around. So be aware of that, that's not abnormal, and then know what your pet weighs. And the weight is really important in any kind of medication that you might want to try down the road. So, okay, so first of all, let's learn what is normal with our dogs. Just like you're familiar with what is normal with you or your children, it's nice to know what is a true fever, what's not a fever, what's too cold, and what is abnormal in my dog or cat. Once we know what is normal, then we can start to identify when we have a problem because we're seeing abnormal values. We're going to talk about the ABCs. You may have seen the ABCs with first aid classes in the past. It's very similar for people as it is for pets. The A is the airway, the B is for breathing, and the C is for circulation. These are basically the really important things that we have to do to stay alive. We have to breathe. We have to have our heart beating. If those aren't happening, we're not going to live. So this is a quick and easy way to remember what do I need to look for when things hit the fan and my dog or cat is really, really sick. How can I help them? So ABCs. Some people will refer to it as the CAB, turn the C to first, CAB as opposed to ABC. And we'll talk about why we do that, but ultimately it's because the number one thing is this one. This is most important, circulation. You can't live very long without your heart beating. You can live a little bit longer without breathing. So CAB versus ABC. So we'll go through it with the ABCs. First is the airway. We want to look at the airway. I saw this dog here just a few months ago, last month actually, where we had this ball stuck in the throat and we had a really hard time breathing, right? So when you're out there playing with that chuck-it ball, just be aware this could happen, and when it does, you're going to be in some trouble. So check the airway. I've seen chuck-it balls in there. I've seen sticks stuck back in the throat. I've seen other foreign bodies stuck in the back of the throat, and they can cause airway obstruction. When you're looking at the airway, you can extend their throat, just like if I'm got my head tucked down here, my throat is going to be closed off. If the dogs have their head tucked down as well, they're going to do the same. So I can extend their airway by pulling the head up there that way, and then I can pull the tongue out of their mouth, and when I do that, I should be able to see in the back of their throat. And if there's a foreign body, you can do the sweep to pull that out of there. Be aware if a dog is struggling to breathe, they are not aware or concerned about you or your fingers, so please be careful not to get bit when you look at their airway. The dog that I had, by the way, when this happened, I didn't do the finger sweep because he was very aware of what was happening and aware that he was choking. So in the end, we sedated him, and once we sedated him, we were able to get that foreign body out, which sometimes when you're choking with your pets, that is where we have to go before we can get in there and safely remove that foreign body. Okay, so breathing here is the next step, the A and the B. You're going to check for chest breathing. You already know what is normal. You've looked at that, you've seen the chest come out, and you've seen it go back down. That's a breath. So you're going to check that first. If we're not breathing within 1 minute, you should have about 10 to 20 breaths per minute. You're just going to sit here and watch and see if that chest is expanding and contracting. And if it's not, within 20 seconds, you've got a problem. So first, check to make sure that they are breathing. If they're not, you can do this mouth to snout process for breathing. You're going to close their mouth and you're going to breathe through their nose. And just like you would with a person on a CPR basis, you breathe through their nose, not through the mouth, right? So close their mouth, hold the mouth closed like she's doing here, and then you're going to breathe through their nose, their snout, mouth to snout, and give them their breath. And it's about 1 to 2 seconds. You should see the chest expand when you breathe, and then you should see it contract when you stop. Okay, so that's your breathing. And then circulation. right? So if we get into the situation where you feel like your dog is not breathing and doesn't have a heart rate, you've already checked the heart rate here, and you check their breathing and it's not happening, you can start the process of CPR. And circulation here is first, and the airway, and then breathing. When you do CPR, it's going to depend a little bit on the size of your dog. And just so you know, I have this in here. This pet first aid kit we have available has these nice cheat sheets, so we're going to help you out. It has a cheat sheet for you to walk you through the A, the B, and the C of CPR, and it'll help you walk you through that process. And it talks about big dogs and little dogs because it's different. When I have a big dog and I'm going to try to compress that chest, I'm going to need a whole body to do so. When I have a little dog and I'm going to compress that chest, I can use my hand. Or if I have a cat, I can use my hand to compress that chest. Chest compressions is the key to a good resuscitation in a patient who is not, doesn't have a good heartbeat. So let me show you just briefly how we might do that. With a bigger dog, you can put them on their side, and once again, the heart's right behind the elbow. So you check the elbow, and you go right behind the elbow. And just like you might with a person, if you've had a human CPR, you can put your hands together, and you can lock your elbows and compress that chest. And you're going to go to the beat of Staying Alive, if you heard that song, Staying Alive. So it's about that fast. And you're going to do those compressions for 20 seconds, and then you're going to do your breaths, and then go back to your compressions. With a cat or a small dog, you can do the same thing behind the elbow with your hand, compress that heart to the same beat, and then do your mouth to stop breathing. Okay, so that's basic CPR. It's a pretty run, quick, dirty process of CPR. All right, so let's talk about the most common things that we need for first aid, because cardiac arrest or respiratory arrest are probably the least common thing that you might see. So what might you see when you're out there? This is a pretty common one. The bees are busy. I've already seen them out there. We've already seen bee stings and wasp stings out there. And this is what it looks like. That is not supposed to be a Shar-Pei. It looks like a Shar-Pei. It's like a Dotson Shar-Pei right now. That is not normal, and this is pretty common, right? Bee stings are really, really common. Allergic reactions are really, really common. And this is typically what you'll see. Facial swelling, and we call that angioedema, and then hives. What does hives look like in a dog? This is what hives looks like in a dog. You see that? Yep, these little bumps. It looks like you might see in a person. The hair tufts up just like you would see on a hive with a dog. And that is a classic type 1 hypersensitive reaction, or an allergic reaction. So these insect stings, bite stings are pretty common. What can you do for that? We can do some pretty simple things. You all have, or most of us have access to Benadryl, diphenhydramine, classic medication for this problem. And here is your dose right there, 1 milligram per pound. 1 milligram per pound, pretty easy to remember, and you can give that every 8 hours. So you can give that orally, Benadryl, 1 mg per pound, and usually that will be sufficient to get that swelling to go down. What you need to be aware of is when this happens, first with the dogs that you saw here, long-nosed dogs, dolichocephalic dogs, you're probably going to be okay. Because a major concern with allergic reaction is 1, they can't breathe, and 2, anaphylactic shock. So 1, they can't breathe, 2 is shock. Those are the 2 really bad outcomes of allergic reactions. This facial swelling is disturbing, but it's not life-threatening in most cases, especially for these long-nosed dogs. For this guy, short squash face nose, who can't breathe already, if you see this, then respiratory distress is going to be an issue. So these guys, it's a little bit more of a heightened concern when they have facial swelling like that. Because if they can't breathe, of course, then we've got a problem. So those you may want to get to the veterinary office sooner than later. And we'll do some treatments beyond just Benadryl. But Benadryl, in the vast majority of cases, will do the trick the swelling will go down, the itchiness will go away, and the bee sting will be no more. Okay? Now in this first aid kit, we do have also some topical steroids, hydrocortisone cream. Hydrocortisone cream is, just like for people, very effective in treating your allergic reactions. And if that doesn't work, hydrocortisone cream or Benadryl, topical Benadryl or oral, then come and see the veterinary office. We can help you. Of course, if you're looking for those two things, respiratory distress or shock, shock is gums turn white, so pink is no longer pink, and they're very, very weak, and their heart rate is going to go up. If you see that, if you see pink gums that are no longer pink, you need to see the hospital, regardless of what you're doing, right? Whatever the cause, if that is the case, it's time. If that heart rate is up and you can't see nice pink gums, you need to come in. That's showing you anaphylactic shock will be very, very weak, and that's an emergency. You need to see somebody right away. You're not going to save that out there in the field. So, okay? So that is a pretty common, allergic reactions are a pretty common thing that you'll see. Anaphylactic shock is not very common, but the allergic reaction is. Okay, all right, here's another one. We see this all the time, getting an altercation, see another dog out there, a raccoon or a coyote or who knows what. I saw a ground squirrel bite the other day. So this happens. These bite wounds, lacerations, barbed wire, pretty common. Okay, so yeah, also with this first aid kit, we have this right here, which is a skin stapler. I'm going to show you how to use that. Really, really effective method of helping to get this to stop bleeding when you're out there in the field. Okay, so bite wounds, lacerations, and abrasions. So what do we do when we see that? First objective, of course, is to stop the bleeding. And anytime we see an emergency, the first question is, relax myself, A, B, C, circulation. Where could this go really bad is if they don't stop bleeding, right? So if you have a really bad bleeder, you got to stop the bleeding. So number one, stop the bleeding. It's the same with you as it is for them. Direct pressure. You have these gauze sponges in here. You're going to take a gauze sponge and you're going to put it right on top of that wound and you're going to put direct pressure on there. And you're going to put that pressure on that wound for 10, 15 seconds. If it's bleeding through, then you take another gauze sponge and you put it on top. And you just keep adding those on top of that wound until the bleeding stops. If the bleeding doesn't stop, you need to come in right away. That's an emergency, so don't wait. And don't remove these, right? Don't put this on there and, oh, bleeding's coming through, pull it off, put another one on. Every time you pull it off, it's going to bleed all the more. So just add on top of that a bandage on bandage on bandage. Okay? Stop bleeding, that's number one. Most of these, the bleeding is going to stop pretty quickly. Once you get the bleeding to stop, you have the povidone iodine in here, these povidone iodine and antiseptic towelettes here. You can scrub that and clean it up, and then you can either bandage it with your bandage here, your gauze bandage and tape, or you can use that skin stapler or you can use that skin stapler. So let me show you how you can do that. So here's one, and I'm going to step forward here so you can see this. Let's just assume this is our cut right there. You guys can see that line, that's our cut. So if you see that cut there, and you stop the bleeding, you can take your skin stapler and you see these two little edges. That's where the staple comes out. And you're going to pinch that cut closed. You see how I closed it there. And while you're holding it closed, you take your skin stapler and you're going to push down, and you're going to push down pretty firmly. The risk is you don't push hard enough on that and it doesn't get your staple. So watch this. I'm going to push that down, and then I'm going to squeeze the trigger, right? Just squeeze the trigger, and it's going to deploy your skin staple. Okay, you see that? Oh, sorry, there we go. And that's going to hold that together, and then you can take another one. And we want them to be about 1/2 centimeter to a centimeter apart. And usually 2 or 3 skin staples is all you'll need to hold that closed, and then come in and see the veterinarian, and we'll take care of the rest. So that's a really nice tool to have out there. if you get into barbed wire or get into some altercation. Okay, so that's your basic laceration. All right, so the next thing that I see pretty commonly is this, toxins. Toxins or poisons. Unfortunately, this does happen, and the most common reason it happens is because dogs, ironically, are not people, and people, ironically, are not dogs. What that means is that what we can take, dogs may not be able to take. And then secondly is, when dogs get into something that they shouldn't, they don't always just take a little bit. Because here's the truth about toxins. It's all about math. Math rules the world, right? So if I take a little bit of a medicine myself, but I take a whole lot of medicine, the whole lot of medicine is going to get into trouble. And dogs don't always understand, or cats, for that matter, don't always understand. One tablet only means one tablet. So what are some common toxins out there? Here's some common toxins that we might come across out in the field. Right, this one right here, decon, rat bait, rodent bait of some kind, traps that are out there in the field. You may not be aware of them if you're going out into the foothills or into the country, but they're out there. And if they get into this type of toxicity, it doesn't take a whole lot to cause them to be in trouble. So what you'll see, if you know that your dog got into this, or your cat got into this, you see them pick it up, you're not going to see anything right away in most of the cases out there, most toxins, particularly decon. If you see them eat that, you need to come in right away. There's nothing that you're going to do out there in the field that's going to help them. You need to come in and we're going to treat them, and the goal is to never see clinical signs. Because once you see them clinically suffer from this type of toxicity, it's kind of too late. We can do some things to save some lives, but it's going to take a lot of work. So you want to get to them before you have clinical signs. Same with this one, right? Antifreeze. If they get into antifreeze, you need to come in. They're not going to show you any clinical signs necessarily. They might look drunk. But they're probably not going to show you any clinical signs. It doesn't take very much. If a cat walks through antifreeze and then licks its paws, that's all it takes. So you want to come in before you see any problems. This causes kidney failure, and if you see kidney failure, it's too late. So when they get into this, you need to come in right away. And then we have some treatments that can stop the damage before it occurs. That's what we want to do. Okay, this is another one over here, sugar-free gum. So xylitol is a bad one. Xylitol is a bad player with sugar-free gum. If they get into your purse or get into your pocket or into your car and they eat that sugar-free gum, that may be a dead patient later on in the day. So that's a pretty toxic problem that we see pretty common out there, xylitol. That can cause the glucose to plummet. That can cause liver failure. So that's a big one. And once again, if they get into it, you need to come in, right? Things that you could do at home, perhaps, would be hydrogen peroxide. Give a little hydrogen peroxide, and that can help them vomit. 1 to 2 teaspoons is usually all that you need, maybe up to 1 to 2 tablespoons. Beyond that, you don't need much more. And that can cause them to vomit multiple times, and that's what your goal is. Grapes and raisins, just be aware that can cause kidney failure. So if they get into it, preferably don't want to get into that. And grapes, by the way, make raisins, they're the same. Mushrooms, there's not too many mushrooms that we have here in Idaho that cause a problem. Usually if they do, it's going to cause them to vomit, that type of thing. And then lilies. Lilium, species Lilium in cats. That is very, very toxic to cats. So Easter is we just got over Easter. If they get into lilies, that's bad. One swipe of the paw on a lily for a cat can kill them. So be aware of that. Lilies are very toxic. Okay, chocolate, baking chocolate, that's the big one. So milk chocolate, not very toxic, but baking chocolate, that is very concentrated in theobromine. That's the agent that we're concerned about. And that can cause cardiac arrhythmias. And we need to see a veterinarian for that. So. Okay, so that's toxins. If you're at home and they get into something, you can call this phone number. It's the Animal Poison Control Center and the ASPCA. And they can give you information. They'll tell you, you'll tell them how much they ate. You'll tell them what clinical signs you have, and they'll tell you need to see a veterinarian or that you don't. Okay, and what to do in the meantime. So that number right there, ASPCA, is going to be a lifesaver for any toxins. Okay, that's toxins. If they get into it, if they're inhaled, fresh air, if it's absorbed topically, give them a bath basically, so there's an oil on them. If it's ingested, you need to talk to the ASPCA or talk to a veterinarian whether or not you should be doing some vomiting. And here's your dose for hydrogen peroxide. If you're at home, you can do that for toxins. Salt, I'm going to say don't do that. Okay? Salt is out there. You can give salt. It can cause vomiting, but it can cause a lot of problems too. If you give that much salt to a dog, you may cause salt toxicity, and then you're in a different position. Okay, so hydrogen peroxide is your safest one teaspoon per 10 pounds. And then give us a call. All right. Big one right here. It's getting hot out there. 80s next week. Hyperthermia is a really common side effect of really nice weather. We all get out there in the heat and we love it and we enjoy it. What we don't remember is we are really good at dissipating heat, humans. Dogs and cats are not. That is one main evolutionary advantage of the human species. We can really get rid of heat very, very well. But these guys cannot do that. So when it's hot, they're at high risk of heat stroke, particularly if you have this type of dog right here, who isn't really designed for hot weather. So if you have a cold weather dog and you're out there in 80-degree weather, you're at high risk for, or 70-degree weather. I work with Iditarod and it's minus 20 sometimes. When it gets to 0 degrees, we're worried about this, hyperthermia, at 0 degrees. Okay, so when it gets hot out there, we have to be aware that dogs are very prone to hyperthermia. Okay, so this is what it's defined at, 104. We already talked about how dogs are a little hotter than most people. So 104 or higher, we have a problem. What you're going to see is they're going to be panting, you're going to have difficulty breathing. You might see the dog kind of trying to burrow in the dry sand or wherever you're at in the dirt, getting into the shade. They won't be really engaged with you. They won't be listening to your commands. Salivation, and then the salivation goes dry. That's concerning. High heart rate. Bright red mucous membrane, right? Once again, there's your mucous membranes. If it's bright red, you've got a concern. And then later on, you'll see bloody diarrhea and vomiting. If you're seeing this, it's late. You need to act right away. That's a dog that needs to go to the hospital. Okay, if you're seeing this up here, you need to cool them off as soon as you can. Okay, so what do? You remove them from the heat. That's pretty obvious, right? Get stuck in the car, remember? Stuck in the car, it's 60 degrees outside, stuck in the car, hyperthermia. So get them out of the heat, cool them off with cool water baths. You can use cool towels on their head, neck, feet. They dissipate heat from their foot. And try to cool them off at a pretty slow, gradual rate, right? Ice is often too fast. Okay, fans also will help cool faster. Okay, if you're seeing bloody vomiting or bloody diarrhea or vomiting, you need to come in right away. That's a patient who needs to be on IV. That's a patient who you're starting to see a lot of complications where you need fluid therapy to resolve those concerns before they get out of control and it's too late. All right, so that's hyperthermia. Pretty quick run and dirty of hyperthermia. Ultimately, check their temperature, get them out of the heat, and cool them off. Okay. Avoidance, of course, is best. Avoid. Dogs need to be with water. If you're out there in the foothills and there's no water around, hyperthermia is very, very likely. So you need to have water at all times for your dogs to be able to cool off. Okay, flip that around. Hypothermia, kind of getting out of the season for hypothermia. This is really uncommon. I have personally never seen this as a primary problem. I've seen it as a secondary problem. But when they get below 98 degrees, they're getting too cold. So what do you do for that? You start to warm them up. Frostbite, we do see frostbite, but that's in temperatures of minuses, which we're not faced with today. Okay. Choking. Got the ABCs. Here is your Heimlich maneuver in a dog. You can certainly use this maneuver in a dog if they're choking. Keep in mind, choking. So this maneuver is going to work when your dog cannot breathe. If they can breathe in any way, if they're vocalizing, they can breathe. Right? If they're barking, if you hear something, they can breathe. And if they can breathe, this maneuver is not going to work. So this is when they are topped off. They cannot breathe. Stuck, choking. The Heimlich maneuver right there. You're going to wrap around that belly and an upward thrust right into your chest, and hopefully you'll be able to dislodge whatever is in that throat. Okay. Eye injuries, we have these Q-tips in here. Eye injuries, and we also have eye flush. This is what you're going to do, right? Use a Q-tip, and you're going to sweep down into the conjunctival sac, not the eyeball itself, but down into that conjunctival sac, and flush it out with eye flush. If that doesn't work, you need to see a veterinarian, right? If those two methods aren't going to get the job done, it's time to come into the hospital. Seizures. Seizures can be a complication of hyperthermia. They can be a complication of a lot of these other different things that we come across. But if you're seeing a seizure, seizure is defined as abnormal electric activity. So if you're doing something funky, that may be a seizure. Seizures can be difficult to differentiate between a variety of other things, but ultimately if you see a seizure, first of all, you need to get them out of danger, right? If they're in a road, get them out of a road. If they're sitting on top of a cliff, get them away from the edge of the cliff. Otherwise, let them be. When a seizuring dog is seizuring, they are not aware of what's going on, and they don't know who you are. So if I come up to a seizuring dog and say, hey, what's going on? The odds of them biting me or hurting me are pretty high. So be aware of that. When you come up to them and you need to intervene, you can take a towel and you can wrap them in that towel. So if they are going to bite, if they're not controlling anything with their body, then they'll bite the towel, not your hands. Okay, so just be aware of that. And then once the seizure's over, you need to see a veterinarian. Okay, do not look into their mouth. Do not look into the mouth. Stay away from their mouth. You will get bit. Okay? If you see a seizure, you need to come in. Ultimately, if you have a seizure, you let them be. You start a timer, and if it's beyond 20 seconds or 30 seconds, you need to come to the hospital right away. Otherwise, you need to come in after the seizure is over. Okay? Good. Car accidents, use your APCs. Contact your veterinarian as soon as you can. Always use a muzzle. If they're in pain, if they have a broken leg, you need a muzzle. And you can use a quick muzzle with your leash. You can do a loop around their mouth here with your leash. I didn't bring a leash, I should have. You can do a loop around their mouth or a muzzle with their leash, and then you can pick them up and bring them in as soon as you can. They will bite you when they're in pain, so be aware of that. If you need a board to transport them so that they don't move, you certainly are welcome to use that, but then you need to come in to see a veterinary hospital. Okay. Torn toenail, this is a pretty common one. So we have this in here. This is quick stop. They hurt. This is your quick stop. This powder right there, if you see a torn toenail like that, you can put that powder on to stop the bleeding. And if the nail is still on there, we need to remove that nail, which we could do, but we probably want to sedate them to do that because it hurts. It's really, really painful. But this right here is a lifesaver because when toenails bleed, they bleed. And a little bit of powder can go a long ways. Stop that bleeding, and you get them in, and we can help us. Okay, and then there's this website or an app right here, American Red Cross app. You can download that on your phone. It's a great first aid app for all the stuff we just talked about. We have the first aid kits here. It has your walkthrough pet kit for first aid care, and it walks you through everything we just talked about. Simple things you can do. Your contact information, what do you need to do when you're, your contact information for your pet, do you have allergies and so forth, and then CPR for your pet, okay? You have that app as well. It's a really good app. I recommend having that app. It'll walk you through whatever concerns you have. All right, guys, so that's it. That's pet first aid. It's a pretty simple, pretty quick process there for first aid. And I just invite you to get out there, enjoy life, enjoy the good weather, stay socially distant, of course, and stay safe.